Welcome to ILFACT, Illinois Families for Access to Comprehensive Treatment. ILFACT is a nonprofit, grassroots advocacy group to address the shortage of mental health services in Illinois. We need your support to pass this important legislation. I'm Dr. Kathy Parker, a licensed clinical psychologist in Illinois. I've worked in the mental health field for 33 years and have a doctorate in clinical psychology and a postdoctoral master's degree in clinical psychopharmacology. One of my passions is providing high-quality, integrated mental health care for the citizens of Illinois. Advocates of prescriptive authority for psychologists believe it would be better for one doctor to comprehensively manage all of a person's mental health care, including medications. The research shows that a combination of coordinated effort between psychotherapy and medication is the most successful, lasting way to treat mental illness. Let's talk about the problem. Over 2.7 million people in Illinois need mental health treatment, including expert diagnosis, talk therapy, and sometimes medication. 1.3 million children in Illinois have a mental health problem severe enough to interfere with their functioning at home, at school, and with friends. Yet only 20% of these children get treatment. Over 300,000 older adults suffer from depression. Tragically, suicide ranks 11th in causes of death for the people in Illinois. Rates are even higher among children and adolescents. Suicide rates number 6 as a leading cause of death for children and is the third highest cause of death in teenagers. Rates are even higher in rural areas. There are not enough psychiatrists to meet these mental health needs in Illinois. There's only one psychiatrist or psychiatric resident per 1,553 citizens in Illinois who need mental health treatment. The U.S. government has said that even fewer medical students are entering the specialty of psychiatry, which means that in the future we'll have even less psychiatrists available. Currently, people have to wait 6 to 12 weeks in order to see a psychiatrist for an appointment. In rural areas, people have to drive long distances to see a psychiatrist. Because of the shortage of psychiatrists in Illinois, 70 to 80% of prescriptions for mental health medications are written by primary care physicians. The average appointment time for a primary care physician is 8 to 12 minutes. That's 8 to 12 minutes to diagnose all of a person's mental health and physical problems, as well as treat them. So what's the solution? Prescribing psychologists, also known as medical psychologists, receive additional rigorous training in clinical psychopharmacology and can improve the access to safe, high-quality, comprehensive mental health care. Psychologists have been prescribing safely and effectively for over 15 years. Psychologists are currently prescribing in the military, as well as in the states of New Mexico and Louisiana. Other states will see prescribing psychologists soon. Psychologists prescribe differently, less frequently, and with less medication than their medical colleagues. This is because psychologists are highly trained in less invasive psychosocial treatments. Psychologists see their patients every 1 to 2 weeks, so we can better monitor side effects as well as benefits of medications. Wouldn't it make sense to see the same provider for psychotherapy and medication? Our opponents say that if psychologists want to prescribe, why don't they go to medical school? Well, let's take a look at non-physician prescribers who are currently prescribing safely and effectively. Nurse practitioners, dentists, podiatrists, optometrists, and physician's assistants all are prescribing safely and effectively in Illinois and are not trained in medical school. Yet compared to these other healthcare providers, psychologists have more postdoctoral training and more training in pharmacology. In conclusion, our progressive legislation will deliver safe, comprehensive, and cost-effective mental health care, especially for the underserved in rural and inner city areas of Illinois. Whether you're a consumer, a family member, a friend, a healthcare provider, or a concerned citizen, we need your help. Legislators need to hear from you, the voting citizens of Illinois, in order to pass a law to allow psychologists with appropriate additional training to prescribe mental health medications. We encourage you to join our nonprofit group and allow us to use your name in support of our legislation. Thanks for checking out the features of our website and encouraging your family and friends to join our group. Together we can do something about the mental health crisis in Illinois.